This is the Business of Government Hour TV, a video companion to our flagship radio program. I'm Michael Keegan, your host. What are the strategic priorities for the Defense Health Agency's Component Acquisition Executive? How is DHA changing the way it acquires products and services? I'll explore these questions and so much more with our very special guest, Dr. Barclay Butler, Component Acquisition Executive at the Defense Health Agency. My co-host from IBM is Mark Newsome. Take a look, take a listen, download the entire interview on iTunes or at businessofgovernment.org. So, Dr. Butler, many folks listening may be familiar with other government mission support functions like finance, accounting, information technology, but not so familiar with acquisition and procurement. Could you take a moment to explain to us, maybe give us a high-level overview of both acquisition and procurement functions?
Yeah, I talked about those two pieces, and I got to emphasize that they're different from each other. Even my own customers in the DHA, they sometimes don't understand that. And if I talk about acquisition, I mentioned it's from the concept development through the system development itself, through operations and maintenance. It could be 5 or 10 years. Through to disposal. And along that life cycle, there are spots that you do procurement. Mm-hmm. You buy a program management office shop. You buy the system that you're going to develop. You buy engineers to deploy the system and operate the system. So there's lots of procurement along the way. Then separately, the procurement itself, this is buying products and services for us to run the hospitals. It's the sutures. It's working with Defense Logistics Agency to get better pricing on pharmaceuticals. It's looking at the strategic sourcing where I can combine things to get better prices for my customers. So the two are very, very different, but they are supportive of each other.
Mm-hmm. That's a great explanation, good distinction. So, leading on your experience at both the government and the private sector, what is your vision for DHA's acquisition strategy, and what are your key priorities?
Acquisition in the Defense Health Agency is a little different, maybe I'd even say a lot different than what you see in the DoD at large. We're structured in such a way that it's a continuation of where we came out of the TRICARE management activity. Okay. Mm-hmm. And we're shaped a lot like how the Defense Logistics Agency is shaped in terms of acquisition. But those two processes are very different than what we see typically in the DoD. And really, one of my priorities is to find out, is that the best way that we should be organized? I want to do a business case analysis and present that to the Admiral for her decision in that are we doing the best practices in acquisition? Because, quite frankly, when the budgets shrink, I don't have the luxury of not doing best practices. Mm-hmm. I've got to do it as effectively as I possibly can. And I want this to be more than just a migration from one organization to another. I want it to be an active decision. So we're working up that business case analysis, and we'll present that to the Admiral for decision. A lot of these different models work very, very well. I'm not saying that the model we have is the wrong model. What I want to do is make an active decision, say, yes, that's the model for us, or not. Mm-hmm. So that's probably one of my biggest priorities in the acquisition world.
Very interesting, and the challenges that you have there. What has surprised you since taking on your new role?
Well, I will tell you the biggest surprise, and it still surprises me today, is that this is such a great job. I mean, I had no idea. I mean, think about it. This kind of feels like one of those back office things that nobody ever hears about. The guys that are doing the policies, is so boring. I said, but no, nothing could be further from the truth. This job, if you think about it, I get to touch just about everything that's going on in the Defense Health Agency. And here's something that's really exciting. I get to do things that I affect the quality of clinical care. And you wouldn't think about that from a contracts guy. But if I can build, for example, a performance-based contracts that incentivize quality of care, wow, I can actually drive how well we treat our patients and drive improvement. Really, a contracting guy can affect clinical care. Wow, that's just tremendous. So I would say that's probably the most surprising thing. And I'll tell you, Admiral Bono, as a leader, what she does is she pretty much gets the person in the seat and then gets out of their way. She really relies on you to do the job, and that's a tremendous amount of freedom. The amount of innovation that she's allowing us to do is just tremendous.
Certainly, that's going to be welcome news to the industry, of course. You talked earlier about the DHA is changing, and they've gone to this joint directorate structure. Given that approach, what changes have you made to the acquisition strategy and your team to provide optimal support to the agency?
Yeah, so the DHA, when it was first formed, it was really kind of formed around shared services, and that was a part and parcel of trying to get better efficiencies out of the organization. The Admiral then felt that doesn't communicate well with our stakeholders. I mean, we're a defense agency. They don't know what HIT shared services means. They don't know what contract shared services group means, but they do know what a J4 means, and they knew what a J6 means. So she kind of realigned the organization to give it that J structure, and within that J structure, it was much easier for our clients and our customers, those folks external to the agency, to figure out who to talk to and how to get their services. So that was a real plus. Particularly in my area, what it really did is it really re-emphasized the role that I play as a J in supporting my fellow J directors. So by building that J structure, it brought out the nature of their particular missions and functions and how I've got to serve them. So when, for example, General Clark calls me up, the J3, he gets my attention. When the J11 calls up for the National Capital Area, I know that's an important thing I need to pay attention to. So it was a focusing way, a way to communicate. It was much more of a communications tool and to facilitate communications than anything else.
What is strategic sourcing? How does DHA leverage this acquisition approach? And are there strategic sourcing vehicles that you're using?
Yeah, strategic sourcing is really important to us at the DHA, at the J4 specifically. This is the way that we can further leverage the efficiencies of having a defense health agency. And I'll give you one example. Today we have literally thousands of contracts around the military health system that buy contracted doctors and nurses and dentists and ancillary staff. Well, we've created a single vehicle, a strategic sourcing vehicle, that will buy all those docs and nurses, where all of the medical treatment facilities can then use that vehicle, common terms and conditions, common pricing across the nation. That is actually under competition right now. We expect we'll have that awarded in the first quarter of 2018. That would be an example of a strategic sourcing. So I go from thousands of contracts to one. Wow, what a huge savings there, with common terms and conditions. Now, waiverable, though, I'll have to tell you, because sometimes, those vehicles, I can't think of everything. There's something that we need that doesn't fit there. So we'll go to a waiver, but we'll use kind of a continuous process improvement as a high reliability organization to modify that contract so we continue to evolve it to get it to be responsive to our clinical needs. That's a good example of a strategic sourcing vehicle. But it's not just that. It's health IT, for example.
Sure.
Instead of having hospitals buy those independently, that can be a push. I can have discovery tools on the network that knows exactly what's there, how old it is, when it should be replaced, and the hospital gets out of the IT business. That computer comes down to them after a 4-year mark and is just automatically replaced because it's outdated. Those kinds of strategic sourcing vehicles lead to much better service for my clinicians and administrators.
Sure. This is rich for the audience, I think, and you've described several things here. You've talked improved forecasts, you've talked industry partner network, you've talked industry days, opportunity-specific industry days. In reference to your industry partner network, what makes for an ideal industry partner?
Wow, that's a good question. I think it's one that has really done their homework, that has studied what the Admiral has spoken about in her speeches, that has studied our strategic plan, that knows what the Joint Health Service ConOps is all about. So they're not coming to me and saying, what keeps you up at night? They're coming to me and saying, I know what your problems are, and here are some solutions for you. Mm-hmm. That is a huge value add to me. So it's an industry that's done their job. They are coming to me and they're showing me. They see gaps and they already have thought about how to fill those gaps. That is a tremendously valuable relationship. I'll invite those guys in any day of the week.
So, Dr. Butler, agile has not normally been a term associated with procurement or acquisition. You've embraced the agile principles, as I understand it, in contracting with forthcoming pilots. Can you provide details on how agile will deliver the change you desire?
Yeah, agile is a concept that was really came out of the software development industry, and it was a concept that didn't look at surrogates of measures of performance. It didn't say that, gosh, you produce these documents, so your software must be doing good. It actually breaks that mold and says, looks at the software itself. How is the software doing itself in very short segments? It also allows you to evolve the requirements. Remember the program manager's iron triangle. Requirements, cost, and schedule, right? Under waterfall, requirements are fixed, and it's cost and schedule that changes. Under agile, it's cost and schedule that are fixed, and the requirements can fluctuate. And it's because the requirements can fluctuate is that as the development of the software goes on, the end customer gets a better product because they get to shape it. Well, take that to a contracting officer and say, hey, I want a contract and the requirements change. And they just get sweaty upper lip. I mean, this is the wrong thing for them to do. But so what we do in the agile software development world is that we create all these artifacts because it is our contracting processes that are very waterfall-ish. And we want to break that mold. So how do I create a contract that looks at the development of the software and the output of the system and has the end customer say, yes, I like what I see as a measure, and keep going along that path as contrasted to any other surrogate measure. That'll be a trick. Although we've done it in government, I just got to find out who's done it and who's done it well and apply it within our own organization. I'll tell you, Colonel Wilson out of our systems design group, he is using agile development, agile implementation. So what I want to do is now marry one of his small projects up with a agile contracting piece, train my contracting officers how to write agile contracts. Now I got a process that I can then expand more broadly.
You know, Dr. Butler, what advice would you give someone who's perhaps thinking about a career in public service?
Well, I've been in and out of public service, and I'll tell you, both domains are tremendously exciting. On the private sector side, wow, the rewards are huge, and the pace is fast. It's really an exciting place to be. Coming back into public service, it brings that added connection to the mission. And there's nothing more rewarding than having that connection to the mission, knowing that you're helping the nation, knowing that you're helping your fellow service members, and that you are really making an impact on how we are progressing as a nation. You know, I remember Dr. Geis, Karen Geis, she was the principal deputy of Assistant Secretary of Defense for Health Affairs. And she was giving a talk at a women's forum, and one of the people asked her, said, what were one of the things you did in your career? And she said, you know, when a door opened, I went through it. Mm-hmm. And most of the time, it was a great decision. Sometimes it didn't, but most of the time it was great. Admiral Bono opened this door for me, and I went through it. Couldn't be happier. It's a great place to be. DHA is a great place to work, and I would encourage public service to anybody.
Wonderful way to end this conversation. Thanks for taking some time out of your day. But more importantly, Mark and I would like to thank you for your dedicated service to the country.
Thank you very much.
I hope you enjoyed this edition of the Business of Government Hour TV, a video companion to our flagship radio program. Until next time, it's businessofgovernment.org.